Need to go, it's the FDA COVID update that the FDA announced yesterday. I don't want to get into all the names and everything because it's very specific. They're combination therapies that are having. We have to look and see what we have here and make sure that people are still, I mean, they're not going to give us, they're not going to be giving the therapy that's not approved. So they will make their changes accordingly so that people can get treated with the right monoclonal therapy. Remember, these are man-made antibodies, and so if they don't work against the Omicron, it doesn't make any sense getting it. Now, if you have the Delta and you still switch to these new combinations that do work, they're going to work against the Delta. So it's not like you're going to give up. If you happen to have, if you're in that 1% or less than 0.5%, and you do have the Delta, these will still work. These work on all of them. So that's the idea.
When someone goes to get a test right now, they're not being told anything other than they have COVID. They're not being told you have Omicron or Delta.
That's correct.
So there's no way for them to know whether they would be getting the benefits of the monoclonal at this point.
The monoclonals work on all of them. So yes, if you are in a high-risk category, you should go get your monoclonal therapy to avoid going into the hospital and or dying, right? So that makes sense. The therapy works that way. So
okay.
Don't worry. It's Omicron. 99.5% of everything out there right now is Omicron. So even if it's Delta or even if it's something else, they all work against it. So anybody who is high risk should get the monoclonal as a prevention.